Hello people, in this video let us look at the pediatrics syllabus for MBBS students, okay, the content of the subject pediatrics. So basically this term pediatrics has come from pedio, of children, okay, iatros, right, iatros is doctor, physician, okay. Listen to how it is pronounced.
Pediatrics. Pediatrics.
So pediatrics is the branch of medicine that involves the medical care of infants, children and adolescents. See, it is not just children, you can't say children, it's infants, actually it's neonates, infants, children, adolescents, because neonate is something like born from birth to 28 days, then infant first year of life, then children, then adolescent. Adolescent age is kind of variable. Right? You can say up till 19, etc. The American Academy of Pediatrics recommends people under pediatric care up to the age of 21. Whoops, that's really too much, isn't it? So this age, upper age is always variable, but lower age is fixed. Okay? So where were we? So pediatrics, let us look at the goals. So manage common diseases of infancy, childhood, evaluation of growth and development, nutritional needs, you should know, immunization schedule, you should know. This immunization schedule is different from place to place, and also this is so vast it has become, there are so much of immunization being done, so you need to remember a lot there. Social pediatrics, counseling, etc. So what else? You should undergraduate, impart appropriate knowledge, skills to optimally deal with major health problems, development of children, okay. Look at the objectives. Here they are including fetus actually. You should know the national health programs. So at the end of the course, you should be able to take a detailed history, do physical examination, right? Bedside investigations you should be able to do. And then you should interpret investigation results. You should be able to plan a therapy. You should be able to distinguish between normal newborn babies and those that require special care, right? You should know all these. Preterm, how to take care. Low birth weight babies, how to take care. How to take anthropometric measurements, right? Like what and all will be there in anthropometric measurements, height, weight, then head circumference and all that, right? Mainly how to prepare this ORS, oral rehydration solution. You should be able to perform tuberculin test, administer vaccines. Then start an IV line. That'll be really hard, I think, because the child's hand is so small, right? And provide nasogastric feeding. Oops, okay. You should be able to observe. You should have observed these procedures. No need to do lumbar puncture, liver, kidney biopsy, bone marrow aspiration, pleural tap, and ascitic tap. Wow. A lot of things that should have been seen by the completion of MBBS Pediatrics course. Lumbar puncture, liver, kidney biopsy, bone marrow aspiration, pleural tap and ascitic tap. Okay. Then provide guidance, counseling and breastfeeding. Provide ambulatory care to all sick children. Right. Then specialized inpatient care for those who require hospitalization, etc. Are you ready to move on to the next topic, integration? Okay, integration, you should be able to integrate the information that you got in pediatrics with everything else, anatomy, physiology, forensic medicine, community medicine, physical medicine, rehabilitation, etc. So basically when it comes to forensic medicine, you should be aware of infanticide, female foeticide, right? All that you should know, right? You should know anatomy, basically embryology, because you need to know what congenital defects can be there, right? Then community medicine as such, vaccinations and nutrition, basically all that you should know. Guys, now we are entering the exact syllabus of pediatrics. So basically, let us see, they are starting with vital statistics. So basically, IMR, PMR, EPMR, what are these? Mortality rates, isn't it? Infant mortality rate, what is PMR? PMR is perinatal mortality rate. EPMR is early perinatal mortality rate. Here they have not mentioned MMR, that is maternal mortality rate. Here they are talking about children, isn't it? Child mortality, morbidity. What is morbidity? Disease. Preventive pediatrics, so basically prevention means how will you do? National programs are there for this ICDS. What is ICDS? Integrated Child Development Services, then MCH. MCH could be Maternal Child Health, RCH, Reproductive Child Health, okay. CSSM, Child Survival and Safe Motherhood, okay. Then Integrated Management of Neonatal and Childhood Diseases, IMNCI, Integrated Management of Neonatal and Childhood Illness. Usually if there is a C, it will be a child. If there is an N, it will be national or neonate. And if there is M, it will be maternal. If there is H, it will be health. Here it is R is reproductive. S is again child here. What is S here? Safety. No, here it is survival and safe motherhood. M usually will be mother, okay. What is I? Integrated. Again, C here you can easily say it's child. D will be development. S is services here. So S can be a lot of things. Services, survival, safe, okay. What is I here? Integrated. What is M? M here it is not maternal. Here it is management. N is always, NC means neonatal child, like that only it will be, okay, illness. Now, neonatology. So, neonate will be less than 4 weeks, right? So, you should know under this high risk pregnancy, high risk neonates, right? Before the delivery itself, they will tell you high risk pregnancy, high risk neonate. Then classification of newborn, gestational age assessment, right? You should be able to assess the age, gestational age, normal newborn care. You should know the normal so that you will identify easily the abnormal, right? Classification of newborn, how will you classify newborn? Premature, right? All that can come here. Not sure if APGAR score comes under this, but APGAR score, etc. will be there. Growth and development, you should know the parameters, monitoring, how to monitor milestones, what are the milestones, when they should crawl, when they should stand, when they should walk. Assessment of development, all this you should know. Development can be so many things, social, physical, all that, okay. Nutrition, what and all you should know, mainly this protein energy malnutrition, marasmus versus kwashiorkor, that it's 100 times they have asked in the exam. Infant feeding, breastfeeding 100 times. Second, lactation failure management, then vitamin deficiencies, vitamin A deficiency, vitamin D deficiency, rickets, everything you should know, okay. How's it going, people? Now let us move on to some bigger things like infections, okay. So infections, you should know MMR, measles, mumps, rubella, chickenpox. You should know chickenpox has a separate vaccine, right? Varicella. Measles, mumps, rubella comes under MMR, chickenpox, typhoid, tuberculosis, then parasitic infestations mean they keep giving deworming medicines, right? Then bacterial central nervous system infections, viral central nervous infections, malaria. Neonatology, respiratory distress, birth injuries, right, low birth weight babies, congenital anomalies like diaphragmatic hernia, cleft palate will teach you a lot, isn't it? In anatomy also they've covered. Cleft lip, pyloric stenosis, right, all these cleft palate, cleft lip have they taught you in the embryology, right? Then pyloric stenosis, that's something to do with the stomach, isn't it? So pyloric stenosis they have depicted here. Thickened muscle pylorus causing a blockage, isn't it? Pyloric stenosis. Neonatal jaundice, you should know, right? Very common, right? Prolonged cholestatic jaundice and neonatal infection. So what else you should know? Genetics, you should know Down syndrome, right? Pediatric emergencies. Now we are moving on to emergencies. Let us look at this. Shock in children. Okay. Poisoning in children. Snake bite, scorpion sting. Okay. Then coming to central nervous system, what is there? Cerebral palsy, this is very important topic for examination. So it will affect the movement and muscle tone or posture. So this would be an important topic for exam. So other mental retardation, hydrocephalus, seizure disorders, including febrile seizures. Febrile seizures happens in children when they have fever, isn't it? What do they give for that? Diazepam. So they are showing hydrocephalus here. So it is actually accumulation of cerebrospinal fluid occurs within the brain. This is CSF accumulation. Or they are just saying it is build-up of fluid, okay, in the ventricles, in the cavities, deep within the brain. Now let's look at gastroenterology, viral hepatitis. Viral. Okay, cirrhosis of liver. Actually, viral you have gastroenterology, you should know about rotavirus, isn't it? Cirrhosis of liver in child, cirrhosis of liver. Let's look at nephrology and cardiology. Nephrology, they're talking about nephritis, nephrotic syndrome, urinary tract infection, Cardiology, rheumatic fever. See, rheumatic fever is when it is in the 5 years to 15 years, isn't it? That's what they say, right? And then cyanotic congenital heart disease, acyanotic congenital heart disease. Cyanotic means deoxygenated blood being supplied, right, by the heart. And acyanotic is where probably the blood is going from the left to the right. So it will be acyanotics. So there's a lot more, guys. Let's look at it quickly now. Endocrine system, you should know about hypothyroidism, diabetes, short stature evaluation. This is important, guys. Short stature evaluation. There could be so many reasons for short stature. Then respiratory system, you should know about respiratory tract infection, croup syndrome. This is quite important, this croup syndrome. Respiratory infection that is usually caused by virus. Then you have pneumonia, bronchiolitis. Then foreign body, you should know these children put foreign body into their nose, into their respiratory tract, into their ear, yeah. Emergencies, guys, fluid and electrolyte disturbances, sodium, potassium balance, all that you have to learn. Then hematology, malignancies, you should know anemia, right, hemolytic anemia, newborn, that you know, right. Then neonatology, neonatal seizures, that you should know, neonatal seizures. About HIV infection, right, then dengue. Behavioral problems, guys, behavioral problems, pica, where they are eating all crap, right, which is non-nutritional. Like, can you imagine people eating some mud and all that? Then enuresis, what is enuresis? Loss of bladder control. Breath holding attack, okay. Then coming to miscellaneous, we're at the end now. JRA, what is JRA? Juvenile rheumatoid arthritis. How is it different? See, this is nothing to do with rheumatic fever, okay. This is rheumatoid arthritis. Then moving on, communication skills, counseling the parents, ethical consideration, etc. Biomedical waste management. This completes the syllabus. Let's see if we have left something. PUO, pyrexia of unknown origin. You have no idea why the person has fever, portal hypertension. Then nutritional exhibition, immunization. What is this? What is the topic? Demonstration. Immunization, gastroenteritis, DTU. What is DTU? It's diarrhea treatment and training unit, is it? Okay, so that's why it's coming under gastroenteritis. Diarrhea treatment and what was it? Training unit. Okay. Diarrhea treatment and training unit. Bronchial asthma, resuscitation of newborn, developmental assessment, pediatric procedures, pediatric resuscitation. Guys, now we have reached a very important point. Please look at this. These are the cases they will give you. So one of these cases it will be, you should be able to examine them clinically. Kwashiorkor marasmus, meningitis, meningitic sequel, cerebral palsy, hemiplegia they can give you, rheumatic heart disease they can give you, MS, MR, carditis, look at all this, mitral stenosis, mitral regurgitation, carditis, all this you should know, congenital heart diseases, ventricular septal defect. What's PDA? Patent ductus arteriosus. TOF, it is tetralogy of Fallot, or you can say tetralogy of Fallot, okay, spelling if you want to be perfect. Pneumonia, you should know, empyema, pus in the pleural fluid. Pneumonia is infection of lung, okay, and what else you want to know about? Empyema is pus in the pleural cavity, pleural fluid. Suppurative lung disease, they can give you a case of suppurative lung disease, they can give you hepatosplenomegaly, the organs, the liver and the spleen have enlarged. Cretinism is what? Hypothyroidism in children. So, cretinism. Assessment of growth and development in a normal child. And they can ask you to assess dehydration. Okay. As when it comes to Viva, they can question you on nutrition, x-rays, drugs, instruments. Okay, instruments, pediatric drugs, x-rays, nutrition, all these can be topics for your Viva. Okay. So guys, in this video, we looked at the pediatrics, what it means, the goals, the objectives, the syllabus, the Viva, how it would be divided, all that we have seen in this video. Hope you have liked this video. Welcome to Pediatrics. Bye-bye.